Hi. Okay, so I want us to talk about abortion, and I'm just going to focus on the management of abortion, specifically septic abortion. So, what is septic abortion? Septic abortion, this is the type of abortion which has which is incomplete, and there is an infection in it. So now, how do you manage uh, somebody with septic abortion? Of course, we know to say an abortion, this is the termination of pregnancy before its viability. An abortion is the termination of pregnancy before its viability. Of course, there are various types of abortion, but specifically I'm going to focus on septic abortion. So, septic abortion, whenever you hear septic, meaning there's an infection. And of course, there are some signs and symptoms that you have to find in somebody with septic abortion. So, how are you going to manage a patient or somebody with septic abortion? So, how do we manage septic abortion? So, we manage septic abortion into management has got two things. Number one, we've got medical management, nursing management. Also, they can give you to write a nursing care plan. That is in IRH. So there is medical management, number one. Then number two, there is nursing management and nursing care plan. So whenever you are given to write an essay, whenever you are given to write, in case an abortion came and they bring septic abortion, just know that when they tell you to write a nursing care or to manage somebody with septic abortion, you start with medical management first. Take note, you start with medical management. And in medical management, there are two things. Number one, there is investigations and treatment. So, on investigations, what do you do? On investigations, of course, you are going to write, number one, you are going to get history. So, firstly, we are going to get history. So, I'll start with medical management first. Medical management. So, on medical management, we have one, investigations. We have investigations. And on investigations, there, what do we get? Of course, number one, we are going to write history taking. Right? History will show you that there will be history of abortion, incomplete abortion. Okay. Then physical examination. Right? Physical examination. And on inspection, right? On inspection, you see vaginal or blood discharge from the vagina. Okay. And then number three, also you can also do abdominal ultrasound. Abdominal ultrasound will show uterine contents remaining in the uterus. Then blood for MCS, for microscopic culture sensitivity, it will show or to isolate the causative organism, or to isolate microorganisms causing the infection. Then from there, after that, you can also blood for FBC. Blood for FBC, it will show elevated white blood cells. elevated white blood cells. Then from here now, after writing this, after writing the investigations, then you go to treatment. So on treatment, somebody with an abortion, a septic abortion. So treatment number one, it has to be focused on what? Doing the prevention metastasis of the infection. So number one, this woman has got what? This woman has septic abortion, and there is infection in there. So number one, you give what? You can give flagyl. Right? You give flagyl 500 milligrams TDS. TDS for 5 days. Then you can also give gentamicin. You can also give gentamicin on this woman. Then apart from that, you can also give you can give ceftriaxone. You can give ceftriaxone. Ceftriaxone 1 gram. 1 gram BD. BD for 5 days as well. You can also give ciprofloxacin. Ciprofloxacin, that is 500 milligrams. 500 milligrams BD for 5 days. Then you can also give paracetamol. Paracetamol 1 gram. 1 gram TDS. TDS for 3 days. Then if you don't have paracetamol, you can also give aspirin as well. So this is how we are going to manage. This is the first. So we've managed this woman now medically. Let's now manage this woman using the nursing care. So the nursing care, your aims will be what? To prevent the infection. Number one, your aim will be to treat the infection. One. Number two, because this woman has already has an infection, so your aim will be to one, treat the infection. Then two, the second aim will be to prevent complications. To prevent complications. So how are you going to prevent complications on this woman? The woman who has undergone abortion, the way you are going to prevent complications. So number one, we said on the aims. Aims number one, we are going to say treat the infection. You are going to prevent complications. Also to offer psychological care to this woman. Then perform the MVA. These should be your aims. Then after this, after you've written all the aims, then you go to the environment. In which environment should this woman be admitted? This woman, of course, should be admitted in the gynecological department or obs and gyn ward. That's where you are going to nurse. Then the environment should be clean, should be well lit, should be well ventilated. Yeah, that is also, and it should also be quiet. We know how to write on the environment. Then from there you write MVA as a procedure, manual vacuum aspiration as a procedure. How do you start writing the manual vacuum aspiration procedure? In this one, you are just going to prepare the room for manual vacuum aspiration. Then you are going to organize all the equipment, that is the syringes and everything that you need to perform the manual vacuum aspiration. When you organize the syringes, you mantle them, you assemble them. After assembling them, then you go. In fact, before you go there, first you need to get permission, because this is a procedure. The way we start, like, good morning, sister, you get permission. You get permission from the in-charge. After you get permission from the in-charge, you've been granted the permission. Then you go to this woman, you get permission, and then you leave that woman comfortably. After that, then you go and prepare the MVA. Once you prepare the MVA, you bring the woman, Then you explain everything that you are doing to the woman and you perform the MVA. So under normal circumstance, I will encourage you guys to go through MVA procedure. And MVA procedure starts with the one, getting permission from the in charge, the ward in charge. Once you get the permission from the ward in charge to say, good morning sister, my name is this, from either Master College or from whichever school, and you've been given permission to perform MVA on this woman who is on bed number so. After that, then you go to the woman, good morning, so I've been given to perform an MVA on you. I understand that you had an incomplete abortion. Don't worry, this procedure will be a little bit painful, but I'll be gentle. Then from there you go to the MVA room. MVA room, you prepare, and then you come to the woman again. You take the woman there, you make sure that you offer, you perform, offer all what is needed to perform the MVA. Okay, thank you so much. Otherwise, there will be anything you ask.